All right, good afternoon, everybody. This is Dr. Valerie Cush, Chair of the Montgomery County Board of Commissioners. I'm very sorry about this very prolonged delay. We are having some really significant Wi-Fi issues here in our office, so I very much apologize for the delay. Today is Thursday, the 12th of November, which is week 36 here in Montgomery County of the pandemic. And today I'm joined by my colleague, Commissioner Ken Lawrence. Since the November 10th press release, we have had 512 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 15,817. These positive cases are a result of a positive test for the virus, not from the antibody test. 201 of these cases are from Wednesday, the 11th, and 311 are from today. 3 of these cases are from long-term care facilities. 16 of these cases are from the Norristown State Hospital, and 493 of these cases are from our community. Of this total number of tests, 477 test results are from the last 7 days or less. 13 tests are from between 8 and 14 days ago, and 22 tests are from more than 14 days ago. Of that 22, 15 are from the state hospital. These positive individuals are from a number of municipalities across the county. As you know, all 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 7 months old to 96 years old. And as always, you can check the county map found at www.moncop.org/COVID-19 for updated geographic information. Today, we have 265 females and 246 males and 1 individual unknown. I am pleased to confirm that no additional Montgomery County residents have lost their life to COVID-19 in the last 2 days, which leaves us at 847 deaths confirmed positive from COVID-19. So as you know, the fall surge in COVID-19 cases continues here in Montgomery County and across southeastern Pennsylvania. We are at a fork in the road of this pandemic. The path that each of us chooses will make all the difference in the next weeks to months. Working together to make safe choices, to share in our sacrifices, and to have compassion for each other will get us to the other side of this in the best possible shape. Working together, we have the collective power to keep this virus suppressed, protect our hospitals, allow our children to attend school, and keep businesses open. If we do not work together, the outcome is clear. The virus will win. Our positivity rate is increasing. Our 14-day average positivity rate is 5.45% as of Saturday, November the 7th, compared with 4.39% on Friday, October the 10th. And just a reminder, when looking at this graph, the orange line in the background is the number of daily PCR tests performed on Montgomery County residents. And then the blue line is the 14-day PCR positivity rate. As a reminder, a positivity rate below 5% is considered suppression of the virus. Now, while not consistently above 5%, this graph, which shows the daily positivity rates from October the 25th to November the 7th, shows that the county is above 5% on 9 of these days. And you can see the direction in which this is trending. Our hospitalizations continue to increase. Today, 171 individuals with COVID-19 are hospitalized in a Montgomery County hospital. That is an increase of 70 individuals from last Wednesday and an increase of 101 from 2 weeks ago. 13% of these individuals are requiring a ventilator. As a reminder, both hospitalizations and deaths lag behind cases. If case numbers continue to rise like we have seen this week, we will continue to see an increase in hospitalizations and eventually in deaths. We now have added information on daily hospitalizations and ventilator use to our data hub at www.moncopa.org/COVID-19. And this screenshot that you see on the screen right now is just a picture of what that looks like. So you can now check the hospitalizations and ventilator use every day at the hub. Why is this happening? Well, cooler weather has two impacts. First, the virus can stay airborne longer in colder air, and so it has more opportunity to infect someone. And second, cooler temperatures send people indoors for gatherings. Private social gatherings and sports and recreational activities continue to be our biggest centers of transmission. Halloween parties, sports-related parties, and sleepovers have been associated with a number of outbreaks among students and student athletes. I understand that parents are well-intentioned. I'm a parent. I understand the pressure to let your children participate in something that feels normal. But parents, these social events, they have to stop. As of yesterday, since September the 7th, we have had 268 students test positive for COVID-19, the majority of those in the last couple of weeks. This transmission, with two exceptions, is happening outside of the academic school day at social gatherings, travel sports, and sports leagues. This activity is putting in-school education of our children at serious risk. I also want to emphasize the impact that this virus is having on the teachers and support staff who work at our schools. Right now, we have at least 100 staff who work at Montgomery County schools who have tested positive for COVID-19. In order to keep the schools open, there must be replacement staff for these individuals while they are recovering. Our Montgomery County superintendents have made it very clear to me that there are no longer any substitute teachers available to hire, and the pool of certified bus drivers has been exhausted. If we do not get suppression of this virus, the schools, due to lack of staff, will be functionally closed. The actions that I'm asking you to take are not going to be forever. We got some good news this week. It appears increasingly likely that there will be at least one effective vaccine that will begin to be available in limited quantities by the first of the year. And hopefully there'll be additional vaccines that are effective. The U.S. Food and Drug Administration issued an emergency use authorization for a monoclonal antibody therapy for the treatment of mild to moderate COVID-19 in adults and children who are 12 years of age and older this week. This medication is for people that are at high risk for progressing to severe COVID-19 and/or hospitalization. And also this week, the CDC confirmed the effectiveness of cloth masks. They said COVID-19 is transmitted predominantly by respiratory droplets generated when people cough, sneeze, sing, talk, or breathe. The CDC recommends the community use of masks, specifically masks that do not have the valves, are multi-layer, and that these can prevent transmission of COVID-19. Masks are primarily intended to reduce the emission of virus-laden droplets, which is really important for people who don't have symptoms and feel perfectly fine and may be unaware that they are infectious to others. And these people who are asymptomatic spreaders are now estimated to account for more than 50% of transmission. Masks also help reduce inhalation of these droplets by the person wearing the mask. The community benefit of wearing a mask for COVID-19 control is due to the combination of these two effects: reducing emission by infected people and reducing inhalation by non-infected people. The prevention benefit to each of us increases with increasing numbers of people who are using masks consistently and correctly. So to repeat, the end is in sight. We have tangible proof that there is an effective vaccine. We have another medication, while not a cure, but it can reduce the risk of serious disease in infected patients. And we have confirmation that something as simple as wearing a cloth mask has significant benefit to our entire community. As we stare down this surge, keep this hopeful news in mind. There will be an end to this, but we do have a number of months to get through before we can begin to return to our pre-COVID lives. My goals for the next several months are, first, to protect our hospitals and first responders. For those elected school boards across the county that vote to offer in-school education, to keep our positivity rate and incident rate of new cases as low as possible, to minimize the risk for our students, teachers, support staff, and bus drivers in our schools. And 3, continue to allow businesses that are operating safely, are following all mitigation measures, and that are not sites of COVID transmission to continue to operate. I hope that you share these goals, because these goals will not be met without cooperation from every person in this county. So what can we do to flatten this surge? The Thanksgiving holiday is just about upon us. Do not host an indoor Thanksgiving celebration with anyone outside of your household or your family bubble. Because of the large increases in cases following Halloween parties, we are extremely concerned about Thanksgiving. Our Office of Public Health has posted guidance and ideas about how to make this Thanksgiving still feel special, and that can be found at www.montcopa.org/Thanksgiving guidance. Do not carpool unless you drive with the windows open and every person in the car has a mask on for the entire drive. If you are able to work from home, please do so as much as possible. And please limit your non-essential trips and travel. Don't leave home without a mask, and put it on whenever you're within 6 feet of someone who is not in your household, even if you're outdoors. Try to keep that 6 feet distance as best you can. Keep your hands clean and away from your face, get tested, and cooperate with contact tracing. And finally, download the COVID Alert PA app, which can help enormously with contact tracing. As I've mentioned, given what we have been seeing since Halloween, we're deeply concerned about a significant spike of cases following Thanksgiving. In an effort to keep students, teachers, and staff able to continue in-person education in those districts that are offering it and those districts that want to offer it, an additional COVID-19 mitigation measure went before the Montgomery County Board of Health for consideration earlier today. If passed, this order will require all schools to offer 100% virtual education beginning Monday, November the 23rd. This is the Monday of Thanksgiving week. This includes a pause on all extracurricular activities, including sports competitions and practices. The planned return to in-person learning is Monday, December the 7th. The goal of this 2-week return to 100% virtual education, which includes the Thanksgiving holiday, and so for most students equates to 8 days of virtual learning, is to help ensure that students, teachers, and staff exposed to COVID-19 over the holiday week have a week to learn that they have been exposed while still at home and out of the school environment. The success of this effort will hinge on everyone involved saying no to private social gatherings. I want to make clear that the goal of this proposed order is to increase the chances that in-person school will be able to continue, that there will be enough teachers and staff and bus drivers. By reducing the number of individuals who come to school with the coronavirus, we maximize the chances that the excellent work that the schools have been doing to limit in-school transmission will continue to be successful. And I just want to take a moment to thank all of our school superintendents and all the staff in all of our schools. Those that have been offering in-person education have been doing an incredible job under very difficult circumstances. I believe it's our job as a community to support them in this work and keep the disease burden, the amount of virus in our community, as low as possible so that what they're doing can continue to be successful. The Montgomery County Board of Health heard numerous comments today and has recessed until tomorrow at noon, when it is my understanding that they will vote on whether or not to proceed with this order. Now, a number of parents have reached out to me asking about closing restaurants, bars, gyms, and salons. I want the public to know that the Office of Public Health is closing restaurants, sporting venues, or other businesses where either mitigation measures are not being followed or we have a documented outbreak, and we have had some of both of those. At this point, our contact tracing has shown that these venues are not the primary points of transmission in Montgomery County at all. Private social gatherings and sports-related activities are the main points of transmission. Now, this could change as more restaurants move indoors, and we will be watching this closely. But to date, this is not where we are seeing spread. I also want to ask everyone to remember that a business that one family considers, quote, non-essential, unquote, is another family's livelihood. We must all work together to get through this difficult time. I want to remind everyone that we continue to have strong availability of testing. I want to urge anyone who wants or needs to be tested to get tested. The more we're able to test in our community, whether you have symptoms or not, the more we will know what is happening across the county and be able to quickly move to suppress outbreaks. Testing continues to go smoothly in week 12 with Mako Medical. With rare exceptions, the county's results are available within the contractually promised 36 hours. I do want to remind people being tested that at the testing site, you'll be given information on how to register to get a text or email directly from Mako when your test result is ready. And that is the quickest way to get your result. As cases are rising, we're continuing to expand testing capacity at our county-run testing sites. The graphic that you see has the updated testing hours for Ardmore, Lansdale, Norristown, and Willow Grove. Collectively, we are now providing 500 tests per day, Monday through Friday, across the county-run testing sites. And as I'm sure you all know at this point, these sites do not require a car to be tested. They will provide testing to you at no cost, though we will bill insurance if you have it. They do not require that you come with a healthcare provider's order. We will test individuals of any age who want or need to be tested. These sites do require an appointment. All appointments are made on the day of testing, beginning at 8:30 in the morning. You cannot book ahead. We do require that the person being tested is a resident of Montgomery County or works or goes to school in Montgomery County. As a reminder, you can register online at www.moncopa.org/COVID-19 under the green County Testing Information button, starting Monday through Friday at 8:30 in the morning. If you would prefer to call, phone registration also opens at 8:30 in the morning. You can call 610-970-2937, and there are multiple language lines available at that phone number. For the 14-day period ending November the 7th, 39,562 Montgomery County residents were tested, which is an increase of 6,499 people tested compared with the 14-day period ending October the 30th. This is great. I'm glad to see so many people being tested. This is exactly what needs to happen. And now we're sharing with you our date tested graph. Just as a reminder, this shows our COVID-19 daily cases and running averages by test date. So this is the big picture. Before we go to the zoom in, I just want to point out that, and I'm sure it's obvious to all of you, that both our 7 and 14-day running averages are nearing our peak last spring. But what is so dramatically different about these averages now is that there are virtually no cases, almost no cases from long-term care facilities. Whereas back in the spring, as I'm sure many of you remember, there were quite a few cases from there. So these cases are all from people in our community. And we can go ahead and zoom in now. And this is that same graph, just a little closer because that graph is now so long, it's really hard to see some of the detail. But these are the running averages for the last 30 days. The two darker red and blue lines are the 7-day average, and the pink and lighter blue lines are the 14-day average. And then down at the bottom, the yellow and the orange are the long-term care facility averages. So I think this graph paints a pretty clear picture of what's happening in terms of positive tests by date of tests here in the county. So this is just another opportunity to remind everyone that another thing that you can do is get a flu shot, and that the Montgomery County Office of Public Health is operating no-cost flu clinics. They are walk-up flu clinics every Thursday until the end of November. They will not be open on Thanksgiving Day, but every other Thursday. And these sites are in Pottstown, Green Lane, Willow Grove, Lansdale, Norristown, and Ardmore. The flu shots will be offered at no cost to individuals aged 6 months and older who live, work, or go to school in Montgomery County. We do ask that you make an appointment for all locations, and to do that, you can go to moncopa.org/flu, or you can call 610-278-5145. Also, just a reminder about that Thanksgiving guidance. It can be found at moncopa.org/Thanksgiving guidance. And finally, once again, just remember that we are at a fork in the road. If we work together, I know that we can suppress this virus. We did it in the spring, and we can do it again. Together, we have the power to keep this thing in check while we await the arrival of vaccine or more treatment options in our community. Please choose the path of making safe choices. Believe that you are not the only person making sacrifices, and have compassion for everyone in our community who is struggling right now. Let us stand united in this fight. If we do that, we will beat this thing. So just a reminder that our next virtual briefing will be next Wednesday, the 18th at 3 p.m. And with that, both Commissioner Lawrence and I are available to take questions.
Thanks, Commissioner. We'll start our questions this afternoon with Todd Shepard from the Delaware Valley Journal.
No questions from me at this time. Thank you.
Okay, thank you. Next up, we'll have Perla Lara from Impacto. Perla, if you're speaking right now, you might be muted. Okay, we'll move on next to Ellie Silverman from the Philadelphia Inquirer.
Hi, thanks for having this press conference. I wanted to ask you more directly about the delayed board vote today. There was a lot of uproar from parents that wanted kids to stay in school, and I wanted to know about, I guess, more directly what your view is on what the school should do with closing for those 2 weeks, and how, what you would say to those parents that are upset about the possible closure. Thanks.
Yeah. So first of all, both Commissioner Lawrence and I were actually in an election board meeting while the Board of Health was meeting. And so I was unable to see the meeting for myself. I have gotten probably a couple dozen emails from parents from on both sides of this question. Some asking us to close the schools out of an abundance of caution, and the majority, though, I would say, asking us to keep the schools open, without taking this 8-day pause. Based on what I have seen throughout the last 36 weeks, and based on what we have seen, particularly after Halloween, my team in the Office of Public Health has come to the conclusion that the best option that we have to keep schools open, and I want to make this clear, we are not trying to close schools for the duration here. We are advising to take a pause around this Thanksgiving holiday and go to a virtual education in the hopes that it will protect the students, the teachers, and the staff so that they can come back in person. And that they believe, based on what we've seen with prior holidays and what we saw after after Halloween, that if people go directly back to school after that Thanksgiving holiday, they go directly back that following week, the chances are that there will be a lot of people who are infectious but asymptomatic and could trigger a very substantial outbreak within our schools.
Ellie, you appeared to be muted if you had any follow-up for the commissioner.
Oh, sorry about that. Just thanks for answering the question.
Sure.
Next, we'll go to Aaron Moselle from WHYY. Okay, we will now open it up to any additional media who are with us this afternoon who didn't get a chance during the initial round, or who have any follow-up questions.
Hi, this is Todd Shepard with Delaware Valley Journal. Commissioner, again, just sort of the same question I posed last week. Is there any set of the data that you're looking at that, whether to the positive or to the negative, that sort of sets Montgomery County apart from your neighbors? Something that you're looking at where you say, this is really making a difference in helping keep our infection rates low, or maybe something where the infection rates are higher and than your neighbors and you're concerned about that?
It's a little hard for me to answer that because I've only been keeping a very sort of general eye on our neighbors, and I'm not deeply familiar with the specifics of what's going on in their counties. I do think, though, it's important for people to remember that there is a lot of back and forth between our county borders. For instance, many of our schools have staff that live in other counties, and the virus doesn't care where any of us live. And so we really are in this together as a region. And the more that we can work collectively to be safe and avoid, in particular, these social gatherings. I do hear from all of my colleagues that social gatherings continue to be a huge problem in all of the Southeast counties, that those are steps that we can take collectively to help keep this whole community safe.
I'd just like to add to that, too, that the other county sports is an issue in all the other counties as well.
Okay, next we'll go to Deanna Durante from NBC 10.
Deanna, you're muted.
Sorry. I had to jump off for a minute to go do a live shot, so I apologize if you've already answered these questions. But I heard a little bit about other county sports. Is there any order that the health department has looked at in just holding off on all sports here in Montgomery County, if that's the issue? And I asked you, Dr. Arkush, a couple of weeks ago about what they're doing in Westchester Borough about limiting gatherings at homes and gatherings at places. Anything like that on the horizon here before you start to close down schools? Put schools to all virtual, I should say.
Yeah, thank you, Deanna. So in terms of sports, they continue to be a problem, I think, kind of everywhere. And it's not so much the time on the field, for instance, it's the time on the sidelines, it's in the locker rooms, it's in the carpools where people aren't wearing masks. We've had actually remarkably little trouble on buses where the kids are spaced out and everyone has a mask on and the windows are open. So again, the recommendation, if you're carpooling, make sure the windows are open and everybody has on a mask. And so we did, if the Board of Health does vote to go ahead with this order, it would put a 2-week pause on all extracurricular activities at the schools, including sports and sports practices, just to give this virus a chance to have fewer people that it can infect over that 2-week period. Again,
that's not all sports, though. That's not all sports. That's just the school sports. Right. That's not the club sports, the travel sports, the cheerleading squads, the hockey team that you mentioned, the hockey rink that you mentioned where people were sitting on the bench without masks. So that's still only a small portion of the sport problem. Yeah, I agree. One of the challenges that we face as a county health department is that we don't have control over all of those entities. So we have, for instance, closed for a 2-week period 2 ice arenas where we had significant outbreaks, one more than the other, but in both locations. So they have been closed for 2 weeks. We have the jurisdiction to close those. We don't have the jurisdiction to ban like these travel teams and things like that. So we're doing everything that we can do, but we don't have the ability as a county health department to ban, for instance, all sports in the county. You mentioned in the beginning of the briefing that we're going to get to the other side. What is the other side here? For months, we were hearing flatten the curve, flatten the curve. The curve was flattened. So then what does this other side look like? Well, now it's flatten the surge. I think if we don't flatten this surge, then our hospitals are going to quickly be in trouble. We're seeing that happen all over the United States. And just like teachers can't find, or schools can't find substitute teachers, we're hearing from our hospitals because of the enormous need for hospital personnel, nurses, and all staff at all levels. There are no nurses or other people to hire either. And our hospitals are starting to get nervous because their staff is testing positive for COVID and having to go out. And so it's not obvious to our hospitals where replacements for those staff are going to come from. There's a nationwide shortage of hospital personnel because of huge outbreaks in the mid part of this country right now. So what's coming next will be, it looks like, a very effective vaccine, and we continue to get more treatments approved. The good news about the treatments, even if they're not curative, if they can reduce the severity of the disease and they can make it less likely that you'll be hospitalized or suffer a serious case, then that's great news. So we have to get through with more of that type of good news and more of those types of medications becoming available until there's enough vaccine that we can have widespread vaccination. In Chester and Bucks and Delaware counties, they all say they don't want to close schools. In fact, the chair of the Bucks County Commissioners said this week when they were having a news conference about how bad the COVID outbreak has become, is that kids are safer going to school in a structured environment. But she doesn't want schools to close either. So with everybody around you trying to keep them open and urging to keep them open, you certainly can understand the frustration and what it was like on that health department Zoom call for those 100 parents that want the schools to be open. Yeah, I get it. I totally understand it. And I can't speak for my colleagues in other counties. What I can speak for is what we're seeing in this county and what our Office of Public Health is recommending
based on what we've seen around holidays. And this is a response to what we've seen in the last couple of weeks since the Halloween holiday. I want to make clear that we are not in any way trying to have schools go to 100% virtual for the foreseeable future. We are recommending that we have a 2-week, which is really for most students, 8 days of education virtual around Thanksgiving, with the goal of keeping the students, the teachers, the staff, the bus drivers, all of those people COVID free so that they can come back the following week and be able to teach again. One of the concerns is, as I stated earlier, you might not have heard this part, is that if there is a large surge after Thanksgiving, we all know, we've seen this happen over and over again. In the first, usually week of that, people are walking around without symptoms. They have no idea that they have the virus, but they're infectious and they're infecting others. And so while the mitigation measures in the schools have been successful so far, and again, I want to commend the schools for their incredible work, the concern is that the schools could be overwhelmed with so many people that are positive that these mitigation measures are not going to be successful. And then we have a much more serious problem in our schools. So we're trying to protect our schools for just a short time with 8 days of virtual learning to get us through a holiday where we think it's very likely that many, many people are going to gather despite everyone's best recommendations not to. And we're encouraging people not to do it, but we encouraged it at Halloween too, and obviously it didn't work. So we have to assume worst case here and do what we can to protect these schools so that they can come back in person.
268 students have tested positive. You're saying that the exception is 2 of them got it in school. And do we know how many teachers or staff members? Did you give those numbers?
We have 100 staff members right now that have tested positive. Again, this is since September the 7th, but the majority of those are in the last 2 to 3 weeks, I would say. And there has been 2 instances of documented transmission within schools. I believe one is teacher to teacher, and one was a teacher and a couple students. I'm not exactly sure which way that went.
Do you have a list of how many places you have shut down or closed for 2 weeks due to COVID outbreaks? I mean, you mentioned 2 hockey rinks. How many other businesses, restaurants, other places like that have been closed because of it?
Yeah, so I don't. And let me just clarify how it works with the restaurant. So the businesses, those 2 rinks, we shut down for 2 weeks because there were significant outbreaks there. The restaurants that we have closed have not been associated with outbreaks. They've been closed because they weren't following the mitigation measures. And so we have a stepwise enforcement action with the restaurants. And it begins with, I believe, a 48-hour closure when they are observed to not be following the mitigation measures, masking, distancing of tables, things like that. They're given a warning and closed, and then they agree to follow the mitigation measures. They are inspected. Again, these are often unannounced inspections. And if they're found to be violating the mitigation measures again, then they're closed for a longer period of time. So it's a graduated sort of stepwise enforcement. And I don't have at my fingertips here a list of those.
I'm going to read this to you. This is a really challenging time in so many different ways for so many different people. And I think each person should consider their own risk benefit of attending a particular event. You said that on June 5th.
Yeah.
And here you are telling everybody, don't gather at Thanksgiving. Don't gather. Don't send your kids here. Don't do this. People are frustrated and they're already not listening. So how do you make them listen when you yourself said every person should consider their own risk benefit of attending a particular event?
Well, that was in June.
It was in June during a lot of protests when we were right there at the height when everything was shut down. So
June was not the height. June was not the height. We've been below 5% since June 18th, and we came out of the yellow phase on June the 26th. June 5th, we were on our way down. Our numbers were clearly going down. Our hospitalizations were going down. Our death rates were going down. The numbers in our long-term care facilities were very, very low. It was a completely different time. We're not in that time any longer.
It was a
We are
time when
in
you
a
were talking
time
about
of a
people
surge.
protesting in large gatherings around and going to protests. It was when you were being asked about going to a protest in another event. I'm simply saying, you said this in June. You told people to talk about the risks. You're saying that the county can't do much to stop all these other events, but yet schools that just opened this week to have kids come in the classrooms are now looking at shutting down after kids have only been in the classrooms for 1 to 2 days to go all virtual because of something that may happen the week of November 23rd.
We are in a completely different situation today than we were in June. Everything, all numbers were going the right way in June. Every number is going the wrong way now. We're hearing from our superintendents that they can already barely staff their schools. We have rising numbers of teachers and staff and students who are testing positive. If that continues, there will be a point where the schools will be functionally closed because they simply don't have enough staff to open. So we are trying to get a lid on this, asking people to go back to virtual for just 8 days over the Thanksgiving holiday, which will hopefully just keep this thing from surging up even higher.
But we can't promise it's going to be 8 days. And if the staff is getting it from outside, do their bosses need to tell them not to do it? I mean, I, for one, get emails saying, hey, be careful, wear these, you know?
Absolutely. Yeah. Everybody should be being careful. People should not be going to social events.
Okay, thank you.
Thanks, Deanna. We'll open it up to the other reporters on the line for one last chance if anyone had any additional follow-up questions for the commissioners. Okay, hearing none, that concludes our questions for today.
Thank you, everybody, and we'll see you next Wednesday.